Right bundle branch and left bundle branch man. To diagnose bundles, you need to look at V1 and V6, and you have to think about your hands. Whatever hand is in the air, that's what bundle branch you are. V1 and V6. You're either this or this. Whatever hand is in the air, that's what bundle you are. So, your criteria for a right bundle. Right hand's got to be in the air. The terminal deflection of V1 has got to be positive. It's got to be wide. And the terminal deflection of V6 has got to be negative. So right now I'm right bundle branch man. V1, terminal deflection positive and wide. V6, terminal deflection is negative. Now I'm going to metamorphose right in front of you, like a transformer, into a left bundle branch man. Ready? Here we go. So now V6, terminal deflection is positive and wide. V1, terminal deflection is negative. I'm now a left bundle branch man because whatever hand is in the air, that's what bundle I am. If you are a left bundle, terminal deflection of V1 will be negative. Terminal deflection of V6 will be positive. Left bundle branch block. Critical questions about a left bundle. You have to ask, is it new or old? A new left bundle branch means STEMI. New left bundle means there's a blockage in a blood vessel that you better remove right away from liquid Drano or Roto-Rooter. If it's an old left bundle branch, like you have an old EKG, the left bundle is irrelevant. We throw it out. It doesn't help us at all with the EKG. So if I call a doc and say, oh, I got a patient who's got a left bundle branch block, but it's old, that just means, okay, can't use the EKG much. And that's got to be out of your mouth right after you say left bundle. They have a left bundle branch, comma, and they're waiting for it. There's a drum roll. Is it new or old? That's what they're waiting to hear. New means STEMI. STEMI means thrombolytics or Roto-Rooter. Picture this. If I say, what are the indications for thrombolytics? What are the EKG criteria for thrombolytics? And let's say I'm not going to answer you with words. I'm going to answer you just in expressive dance. What are the EKG criteria for a STEMI? Does that make sense? 2 up and 2 down, or new left bundle. Right bundle, terminal deflection in V6 is positive. Terminal deflection in V1 is positive. Terminal deflection of V6 is negative, albeit that it is a small. That's a right bundle. Okay. Only looking at V1 and V6. Normally, what happens with right bundle branch blocks, you have pulmonary hypertension, which means the right side of the heart's trying to beat against a high resistance. The right bundle, the right side of the heart gets bigger to try to compensate for that increased pressure. So typically you see right bundles with long-standing pulmonary disease such as COPD, cystic fibrosis, idiopathic pulmonary fibrosis. Hey, if you got someone with a right bundle branch block and their bicarb is 34, 35, does that make sense to you? So if you've got someone with long-standing COPD, they'll have a right bundle and they'll retain carbon dioxide. So carbon dioxide's up, bicarb will be up to compensate for that. I hope that makes sense. If you have someone with an acute right bundle branch block, they had an EKG a month ago for, like, let's say a physical for an ankle fracture. They get acutely short of breath and now they come in, they have a right bundle. What acute pulmonary pathology will come on like that? You got to think PE. If you have an acute onset of a right bundle, better bark up the tree of a pulmonary embolism. This was the gentleman that came back, the 38-year-old that needed a heart transplant. Is there a bundle branch on this pattern? Is there a bundle branch pattern on this 12-lead? Remember, whatever, we're only looking at V1 and V6. Whatever bundle it is will be positive. So V6 right down here, terminal deflection, do you agree that it is positive? Okay, so it's pointing up. V1, it's pointing down. So we got the right morphology. Then it comes down to, is this wide? Is this greater than 3 small boxes? And when it comes down to it, it was slightly bigger. Okay, So that also is an EKG criteria for thrombolytics. It is a STEMI. He has all these elevations, but this branched into a left bundle. There's no worse prognosis than someone with a STEMI who presents with a left bundle.